Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in patient safety. This session about team and effective team communication. Objectives of this session to discuss the importance of team communication, describe the purpose of handover and how they can impact patient safety, and also would like to execute structured team communication like SPAR communication, briefing, debriefing. Team communication is very important. It is critical for team success. Teams that does not communicate with each other, it's just group of people standing together. They are not a team. Part of the success of the team is to have good team leadership. Team leadership, it engage all team member. They call them with their name, especially the first name. It involves team member in two-way dialogue. They encourage feedback, respond to suggestions, and it is very important they have respect. According to Joint Commission, communication failure account for a large number of serious healthcare events, including patient injury and death. Patients are exposed to a lot of teams in the same geographical area. People they switch, they shift, and also patients get moved from one place to another place. 70 to 80% of medical errors are related to poor team interaction. 63% of sentinel event occurrence mainly are related to communication breakdown. Transition of care, the exchange between healthcare professional of information about patient accompanying transfer of responsibility. This happen many times during the day, and it happen in a lot of occasions during the process of patient care. At the end of the shift, when you involve someone for consultation, or even when you send your patient for doing some studies like echo or CT or MRI. So at the end of the shift, at the end of the week, when someone is going for vacation or he ended his rotation, and also when we transfer our patient from OR to floor or to ICU, or sometimes we transfer patient to another institute. Handover can be associated with harm. This can jeopardize patient safety, it increases the risk of medication error, delay in treatment, failure to review investigation, wrong or delayed diagnosis. It can be associated with medical legal issues. And when you receive a patient and you don't know a lot about that patient, this increases anxiety, stress, inefficiency of the caregiver, and also it lack of information or missing information, it affect the patient trust and the family trust of the healthcare organization. So good handover can reduce this risk. In large multi-center study, resident physician handover, uh, it can increase medical error rate by 24 error per 100 admission, and preventable adverse event rate 4 event per 100 admission. Handover, it improves patient outcome, it increases patient satisfaction, it increases staff satisfaction, reduce error, and reduce liability and medical legal issues. So during handover, when we transfer information to another provider, it is time we sit, we think, we synthesize the information and clarify uh, issues and set priorities. Sometime uh, this is an opportunity to correct the course of event, and it's also an opportunity for a second opinion. The second guy can ask and probe the information, and it's also a teaching and learning exposure and rescue from fixation. So it can create opportunity to do more stuff to improve patient care. To have a successful and good handover, we have to have a designated time. Environment should be no interruption, no noise, no distraction. It is better to be face to face, but in some time you might need to do it over the phone. And when we use a structured tool, this can improve the communication. A structured tool like SPAR or iPass. So this improves the communication and presence of an experienced like Syrian resident or some of the faculty. It can improve the communication, and some institute they encourage this to happen in the presence of the patient himself or a family member. So patient is part of the process. If we don't do good communication, then there will be communication breakdown, and this could be due to many or multiple factors: different communication style, stress, time pressure, frequent interruption, complex healthcare environment, high activity level, no standardized or structured communication tools.
Josh, you're on tonight, right?
Yeah, at 5, and I've still got 2 discharges to do.
Okay, well, I'm trying to make it out in time for Journal Club, so I'm going to sign out. 6B, who came in this afternoon with abdominal pain, he had some blood work and x-rays, but he's booked for an abdominal CT tonight.
Dr. Thomas, can Mr. McKnight have something more for his pain? His BP is 95/60.
I'm never going to get out of here. Have a good one.
Dr. Best, call 14928, please. Dr. Best.
It's Dr. Best. You paged?
Dr. Best, Mr. McKnight is crashing. The ICU team was called.
Who?
Mr. McKnight in 6B came in with the abdominal pain. Dr. Thomas told you all about him.
ICU wants to know his code status.
I have no idea.
Well, with his history of cancer.
What cancer?
And they mentioned something about the free air on his x-rays?
I thought Dr. Thomas looked at his x-rays.
Oh, he couldn't have. They weren't even done until after he left.
I don't believe this. I'll be right there.
So, in this short video, there are a lot of factors that can lead to error. The two guys are not facing each other, they are not concentrating with each other. So it was done in a very busy environment. The first resident get interrupted by a nurse to write a prescription, and then he got paid, and then he left. So it was a very casual talk. So there is no structured communication, and the second resident didn't know about the patient, and so they didn't set priority or goal of care, and even he doesn't know about consultation. So if you want to Spark communication is one of the structured tools for communication in the transitional zone. Some people use SPAR, some people use iPass. In SPAR, it's about situation, background, assessment, and recommendation. Situation, it is what is going on now, concise statement of the problem. Background, pertinent and brief information related to the situation, what had happened, and then you do your assessment. What do you think? What did you find? And then recommendation, your suggestions. For example, in the previous scenario, situation, this is Mr. John in room 521. Situation, he has acute abdominal pain and distension, and also this leading to shortness of breath and hypoxia. Background, the guy is known to have heart failure, COPD. He had colon cancer, stage 4. He had a colostomy 2 days ago. My assessment, he has an acute abdomen now. I'm worried about perforation, but at the same time, I'm not sure if he's having a exacerbation of heart failure or flare up of his COPD. And my recommendation, I requested abdominal x-ray plus chest x-ray, and I asked the internal medicine to review him and the surgery team to come and assess his abdomen. Also, we would like to sit with the family to set treatment goals. Another tool for structured communication is briefing and debriefing. Briefing is a short structured meeting in which the patient care team come together and talk about patient procedure situation. Its characteristic of this briefing, it's concise, it involves everyone on the care team. Usually it has to have a flat hierarchy, call people with their name, it requires two-way dialogue. Usually briefing happen before event, before procedure. Debriefing, it happen after the procedure. So a concise exchange of what occurred after such an event have completed. To identify what happened, what was learned, and what can be done better next time. Effective debriefing depends on the effectiveness of briefing. Debriefing conversation should be focused on the common goal and have a positive tone. So teams that if they do good briefing and if the team has a good team dynamic, when they come in the debriefing, people can come with suggestions about improving the situation and about improving team performance in the next time or future time. Another tool for structured communication is verbal repeat back, or some people they call it closed loop. This type of communication when you are giving an order in a busy situation or over the phone. So for example, when I call my nurse and I ask her, please give Mr. Ali in room 221 40 milligram of Lasix IV stat. So the nurse repeat. So I'm the sender, I stated the information. Then the receiver repeat back, Dr. Abdurrahman, you want us to give Mr. Ali in room 221 Lasix 40 milligram IV stat. Then I acknowledge that, and if there is any missing information, I can correct that. Verbal repeat back also needed in busy situation when you are leading resuscitation team, trauma team, or code blue team. For example, if I give an order, please give epinephrine 1 milligram IV stat. So the nurse should repeat that, and also when it is given, should give a feedback that the medication was given. So take home, effective communication is crucial for successful team process. There are different tools for structured communication. In the transitional zone, we use SPAR or IPASS. Other structured tools like briefing, debriefing, and closed loop communication. All these are important for successful team communication, and this will improve patient safety and reduce error. Thank you.